Jeremy, who was 10 years old, lived with his grandmother and mother. A move arose when his parents separated when he turned 5 years old. Jeremy was a straight A student until recently. His teacher confronted his mother and reported that Jeremy is in danger of failing and getting left back the grade. Jeremy is often caught daydreaming, looking out the window in class, and doesn't finish his classwork. When asked, Jeremy states that the other children in his class are smarter than he is. He loved baseball and was an active member of his Boy Scout troop. Now he seldom goes to Boy Scouts meetings or plays baseball. When he gets home each afternoon, he watches television and eats all the cookies he can find. After that, he calls his mother to make sure she's alright and on her way home from work. Then off to bed he goes. He states, I don't have a reason to stay up. Nothing good is going to happen. Popular 16-year-old Kristen usually went to school, her part-time job, and then hanged with friends. Suddenly, after work, she would go straight home to complete her homework and play with her cats. She was a really popular teenager. She would often hang with her schoolmates friends after she got off work until curfew. Concerned, her mother realized that Kristen has not gone to the movies or shopping in a month. And on top of that, Kristen seemed to have lost weight. After cleaning Kristen's room one day, her mother found a bottle of sleeping pills. What do Jeremy and Kristen have in common? They both have been diagnosed with depression. Depression is the most common mental health problem in the United States. Each year, it affects 17 million people of all age groups, races, and economic backgrounds. Depression is a medical illness that causes constant feeling of sadness and lack of interest. Depression affects how the person feels, behaves, and thinks. Emotional and physical problems are what depression can lead to. Most often, people with depression find it rather difficult to go about their day-to-day activities. It may also feel like life is not worth living. Thus said, imagine you or your child at the age of 7 or 16 becoming depressed and having these thoughts and feelings not knowing what to do. Childhood depression exists all over the country, and the causes for childhood depression vary from child to child, from family to family. The signs and symptoms should be looked out for in children who experience life-changing events that occur in their life, because these events have negative effects on children and can cause them to become ill, and they can even be fatal. According to the depressedchild.org, depression is dangerous. It distorts normal perceptions, causes behavior changes, and can result in self-mutilation or suicide. It is uncommon in children. It is not uncommon in children, but for many reasons, it often escapes diagnosis. Depression was not even recognized as a childhood disease by the psychiatric profession until 1980. Before that time, it was commonly believed that children just cannot suffer from depression. Childhood depression can cause children to lead to suicide, which would devastate family members and loved ones. Diagnosis. The diagnosis of childhood depression often begins with a physical exam by a doctor, usually a child's pediatrician. Because certain viruses, medicines, and illnesses can also cause symptoms of depression, the pediatrician will want to know when the symptoms started, how long they've lasted, and how severe they are. The pediatrician will ask both the child and the parent whether or not the child has had similar symptoms of depression before and about past treatments that they may have received. If there is any family history of depression, it is very important to let the pediatrician know this in advance. Since there is no actual test for depression, the pediatrician might refer the child to a mental health specialist to diagnose symptoms of depression, since there are certain features which the specialist will look for in order to make the proper diagnosis. Symptoms. The symptoms of childhood depression vary from child to child. Childhood depression is often undiagnosed and untreated because they are usually viewed as normal and psychological changes that occur throughout the childhood years. According to WebMD, early medical studies focus on mask depression, where a child's depressed mood was evidenced by acting out or angry behavior. Even though This does occur in younger children. Many children of all ages show symptoms of sadness or low mood similar to adult depression. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Signs and symptoms of depression in children include irritability, anger, increased sensitivity to rejection, continuous feeling of sadness and hopelessness, a change in appetite, either too much or too little, social withdrawal, change in sleep, either too much sleep or not enough sleep, reduced ability to function during events, vocal outbursts or crying, difficulty concentrating, fatigue or low energy, feeling of worthlessness or guilt, physical complaints such as stomach aches or headaches that don't respond to treatment, impaired thinking or concentrating, and thoughts of death or suicide. Not all children have these symptoms when they're being diagnosed with depression. Most children will show different symptoms at different times in different settings. Some children will go about their day-to-day activities when being diagnosed with depression, but most children with significant depression tend to have noticeable changes in social activity, academic performance, and change in appearance. Some children may also become substance abusers, turning to alcohol or drugs, especially if they're over the age of 12. Causes and effects. The causes of childhood depression also vary from child to child. As in adults, depression in children can be caused by any combination of factors that relate to physical life, health, life events, and family history. Depression is not a passing mood, nor is it a condition that will go away without proper treatment, according to WebMD. Divorce is one of the life events that causes childhood depression. The breakup of marital bonds concerns not only the parents, but also the children. Therefore, according to Dr. Waterick, it is important to pay attention to the consequences of divorce on children in both the short and long terms. Abuse can cause any person to become depressed, but when children are abused, whether sexually, physically, or emotionally, this can cause them to become extremely depressed even when they get older. The effects of abuse can be short-term and long-term. Almost 1/4, equaling 21%, of female patients in community mental health centers are depressed and have a history of childhood sexual abuse, according to Dr. Court. Maltreatment is another form of abuse that can cause a child to become depressed. Each year, estimated 3 million children are referred to Child Protective Services for alleged maltreatment, and 1/4 of these referrals, equaling to 750,000, are substantiated, according to Dr. Crow. Death of a family member is also a contributing factor to childhood depression, especially if the death is of a parent or sibling. Children under the age of 7 don't often understand the passing of a loved one, but those over the age of 7 understand, and this can cause the children to become depressed. Children who have lost close relatives tend to shut down and become socially withdrawn from others, which are symptoms of depression. Social acceptance is another cause for childhood depression. Children often want to be accepted by society, and when they're not, they become depressed. Being a part of a social group is important. There is also evidence that teasing contributes to risks of other disorders as well as depression, according to Dr. Bennis. Treatment. The mean age of onset for childhood depression is 14.9 years old, which is 14 years and 9 months. But some children can develop depression as early as age 3, according to Dr. Liu. Treating children with depression is very similar to treating adults with depression. Treatments for childhood depression include psychotherapy and medication, just like treatments for adults. The difference in treatment for childhood depression and adult depression is the role family and the children environment play in the treatment process. A child doctor may consider psychotherapy first and then refer to antidepressants as an additional option if the psychotherapy isn't showing adequate improvement. WebMD states the best studies to indicate that a combination of psychotherapy and medication is most effective in treating depression. During psychotherapy, a child with depression talks to a licensed and trained mental health care professional who helps them work through the factors that might be causing their depression. understanding behaviors, emotions, and ideas that contribute to their depression as well. WebMD states that during a session of psychotherapy, a child understands and identifies life problems or events like major illnesses, a death in the family, or a divorce that contribute to their depression and help them understand which aspects of those problems they may be able to solve or improve, help to restructure ways of thinking, negative attributes and attitudes someone has about him or herself, and ways in which faulty thinking may perpetuate depression, regain a sense of control and pleasure in life, and learn coping techniques and problem-solving skills. Antidepressants are medications that are used to treat depression in both adults and children. Studies show that antidepressants like Prozac is the most effective in treating depression in children and teens. The drug is officially recognized by the FDA for treatment of children ages 8 through 18 with depression, according to WebMD. Children. It is important to talk with your parents every day. Your parents will take the time to talk to you, even if they don't necessarily have the time. If you express the urgency and importance of your need to talk to them, they will definitely listen. According to betterlife.org, if you have feelings you don't understand, tell your parents. You should know that many other things you will feel will continue to change as you grow. There are chemicals in your body called hormones. They will sometimes create confusion in your mind and what's going on with your body and your mind. Your parents went through the same changes and they do understand. They can really help if you just ask them to. Parents. Most of you think that it is your duty to make sure that your children are happy and remain happy. For the most part, this is true, but the depressed child needs some other sort of affection. When you realize that your child is depressed, you will ask yourself the famous question, what did I do wrong? Thus, blaming yourself for your child's unhappiness. You may feel guilty because you're trying your hardest to bring your child some happiness and nothing seems to be working. You may think that you're the cause for your child's depression. This is not true. As a parent, it is important to try to refrain from struggling with guilt, frustration, or anger when your child is depressed. If this is the case, you yourself should consider counseling. In the long run, this can help you and your child, both. But there are other ways to help your child overcome their battle with depression. According to kidshealth.org, there are 5 ways to help your child overcome depression. First, make sure your child takes any prescribed medicine and encourage healthy eating soon, as this may improve mood and outlook. Second, make sure your child stays active. Physical activity has been shown to help alleviate symptoms of depression. Just incorporate physical activities such as bike riding or walk into your family's daily routines. Third, offer your love and support and remind your child that you're there and want to hear what he or she has to say, even if it isn't pleasant. Although these things may be difficult for your child to believe, it is important that you say it to them. Fourth, accept the situation and never tell your child, snap out of it. Remind yourself that it isn't laziness causing your child's inability to get out of bed, complete chores, or do homework. He or she simply does not have the desire or the energy to. However, you can still praise and reward your child for making a little extra effort. Lastly, watch for warning signs and make sure the prescribed treatment is followed directly, whether it's medication, therapy, or both. Call the doctor if you see any signs that your child may be thinking about self-harm. If your child talks about suicide to you or anyone else, or shows warning signs such as giving belongings away and being preoccupied with death, call your doctor and mental health professional immediately. Depression is not something that is easy to deal with. Depression can cause families to become frustrated and scared. With family support, proper treatment, and parental guidance, your child can start to feel better and move on to enjoy the years that they have ahead of them. Children find it difficult sometimes to talk about certain subjects with their parents. Their other option is to talk to a friend or another adult who they feel they can trust and believe has their best interests at heart. There are organizations that are nationally recognized to help children cope and overcome with their depression if they don't have anyone else to talk to. One organization that brought attention to my eye. It's SAVE, Suicide Awareness Voices of Education. According to their website, SAVE is the one of the nation's first organizations dedicated to prevent suicide and depression. It was a co-founding member of the National Council for Suicide Prevention. Their history and growth from an all-volunteer, small grassroots group of passionate survivors led them to what is one of today's leading national not-for-profit organizations with staff dedicated to prevent depression and suicide. Their website also, along with their work, is based on the foundation and belief that suicide and depression should no longer be considered a hidden or taboo topic, and that through raising awareness and educating the public, they can save lives. All of their programs are designed on the basis of their 4 goals, which are to increase knowledge about depression, other brain illnesses, and the need for assessment and maltreatment as suicide prevention, increase knowledge about symptoms of depression and the warning signs of suicidal thinking and behavior, increase understanding and the use of intervention skills that can help avoid the tragedy of suicide and treat depression, and also increase knowledge about community resources and how to access and use them. You can find more information about SAVE and what services they offer in your community by visiting their website at www.save.org. As a parent, it is sometimes easier to deny that your child has depression. According to kidshealth.org, as many as 1 in every 33 children have depression. In teens, that number may be as high as 1 in 8. So it's wise for parents and caregivers to learn about depression and how to help if your child or a child you know seems to be depressed. Depression occurs in 1% of preschoolers, 2% of school-age children, and 5 to 8% of adolescents, though prevalence rates appear to be increasing from generation to generation with earlier onsets, according to Dr. Liu. These children are diagnosed with depression because of traumatic life events, and they often have these events stored in their memories years later. As an adult, depression may occur again in later life. Depression often occurs at the same time as other physical illnesses, and because studies have shown that depression may precede more serious mental illness later in life, diagnosis, earlier treatment, and close monitoring are crucial, according to WebMD. Constant monitoring in children and continuance of therapy are very useful tips for making sure children are being well treated for depression in order to get rid of the depression disorder. The major effects of depression in children is suicide. So parents, pay close attention to any changes that your children are having in their appetite, appearance, social life, etc. Depression is no joke. Don't let your children suffer.